Welcome to Common Ground, the program that deals with substance abuse and recovery. Too many people lack the information that this issue is an epidemic and believe that the problems associated with it are limited to the substance abuser. Nothing could be further from the truth. We are all affected. Our communities, schools, where we work, even our families. We all have a stake in this. We are all on common ground. The answers lie in education, prevention, and treatment. And start with information. Through interviews with experts, medical specialists, and those themselves recovering, we provide that information so that together we can make choices that will benefit individuals, families, and our communities, ultimately saving lives. And now, your host, Jim Hall.
Well, good evening, everybody. This is Dr. Joe Shrand covering in for Jim Hall. My co-host, Bill Carpenter, is off tonight. This is 95.9 WATD FM, Common Ground. Please feel free to call in at any time if you would like. 781-837-4900. That's 781-837-4900. So addiction is not confined to the South Shore of Massachusetts. It is a global problem, and because it is global, there are treatment programs all over the world. We have treatment programs here in Massachusetts, in New York, and everywhere. And tonight, we're very fortunate to have Tom Deitzler, who is the Senior Clinical Director of Adolescent and Young Adult Services for Caron, which is a major resource, a comprehensive addiction treatment recovery for life. Caron has been around for more than 53 years. Caron Treatment Centers stood the test of time. It's one of the oldest and largest treatment facilities in the United States. And I'm hoping that we have Tom on the line. Tom, are you there? Tom is not there, but that does not mean he will not be with us momentarily because he is far away. It takes a long time to get here from wherever Tom is in Pennsylvania. Tom, have you made it yet?
I've made it.
All right. Well, I'm Dr. Joe. Thanks so much for being on the air with us. And I just want to let the audience members know that Caron has been very generous to Common Ground. They are a major sponsor of ours, which really is a very generous gesture because they're far away, we're far away, but we're all in this together, helping kids and adults in need. So, Tom, delighted that you're with us here tonight. Can you tell me a little bit about Caron in general?
Sure. We are a treatment center located in central Pennsylvania, Wernersville, about a 45-minute drive east of Hershey, about a 1-hour drive northwest of Philadelphia. Been in operation for 50-plus years. Started as a treatment center by Richard and Catherine Caron, and their mission was to help drunks get sober, and we've expanded now to what we think is the most sophisticated treatment center in the world, doing specialized treatment from adolescents to adults. And our company, through the leadership of Doug Tiemann, our CEO, and Mike Early, our Chief Clinical Officer, have grown to 800-plus employees today.
That's incredible. That's a lot of people out there helping those in need. So just from a location point of view, you've given me the geography. Is it out in the country for these folks? What's the setting like?
We sit on the top of a mountain. Wernersville is a quaint Pennsylvania Dutch community. The campus, which you can see at caron.org, caron.org, basically right now looks like a small college campus. Very beautiful aesthetics, a serene setting, and it provides just the right atmosphere, in my sense, for someone who is suffering from this illness to come and feel free to get the treatment that they need and move on to the next phase of their life in early recovery.
So the setting sounds, as you say, quite serene and beautiful. What a great place to begin this long road, sometimes long road of recovery. Can you tell me more about it? And Tom, again, I appreciate you being here. Tell me a bit about you and your role. How did you get interested in this particular population?
Well, I got into the field 24 years ago. My first life, I was an industrial engineer, and my own addiction took me on a path of self-destruction, lost family, lost my health, actually dead on arrival to the hospital.
Wow.
And in my early recovery, Father Joseph Martin from Father Martin's Ashley challenged me on possibly becoming a therapist at some point in time when I get some good quality recovery myself. When he told me that, I doubted his priesthood and thought that he may be more insane than me, because I never thought that I would want to work with alcoholics and addicts. But here I am today, 24 years later, and I feel I have the best job in the world, Dr. Joe. I treat adolescents and young adults on a daily basis, and I just feel that myself, my staff, and Caron treatment centers makes a difference in lives every day. It's just, it's with great gratitude that I have this opportunity to speak to you, but it's even more gratitude with what I had the opportunity to do each and every day. It's a real blessing.
It's an incredible story, Tom. I mean, dead on arrival? I mean, that's remarkable. And I'm just curious, do you share that story with the kids?
Well, I use my story to my advantage. When I get to look in a young man or woman's eyes, I don't like to go into my own story, but I can tell them that I knew a young man one time, and this is what he told me he experienced when he was where you were at. Also in my story is a youngster being sexually abused by an uncle. I was orphaned by age 13, raised by a grandmother. And I use those opportunities to be able not to tell any patient how they feel, but just let them know that I knew someone at some time in my career that told me this is what they were challenged with and this is how they worked through it. When that patient comes back to observe an anniversary, something like that, I will always inform them of the fact that time you sat in my office and we discussed those issues, that young man that I was talking to you about was me. Through the course of generations, most of the patients know who I am, what I'm about, and segments of my story. They respect me as a man who has integrity and wants nothing but the best for them. To my adolescent and young adult females, I'm kind of like the grandfather figure, and to the boys and young adult males, I'm kind of like the drill sergeant in boot camp. But the message is always honest, delivered with integrity, and consistent, that I want nothing but the best for them and for their parents and their family systems.
Yeah, and these adolescents can see right through phoniness. Don't you find that?
There's no question about it. They just have a manipulative sense, but yet they know that when someone is genuine and really wants to help them, and I think that's what I bring to a great treatment team and the patients, all sense that very early on in their transition to Caron and to the treatment philosophy that we have, and that is that the patient is the family and the family is our patient.
Huh. You know, I'm so honored, and I hope the audience that's listening recognizes the honor that we all have, that you are sharing your story in such a very personal way within just a few minutes of us chatting. I mean, I'm grateful for that. And I can just imagine what it must be like for your kids to be sitting with you and with a staff that sounds really so compassionate. You know, one of the things that I like saying, because I'm a psychiatrist and I work, as you do, with adolescents struggling with addiction. We have a program in Brockton called Castle, which is Clean and Sober Teens Living Empowered, and it seems very similar to yours, except certainly it's in Brockton. So we're not on the top of a mountain looking down over anything particularly beautiful. We're looking, you know, and the back of our place is the Montello train station. But besides that, isn't it that there's this remarkable feeling that you get when you're working with these kids? I mean, here they come in, you know, their minds addled with drugs and alcohol. And I wonder, do you find that really within a short amount of time, they realize that you're there not being judgmental, just there to help?
Absolutely. I feel that the clinical alliance that we bring happens so quickly, and I truly believe that our staff has been coached and mentored and supervised, that we deliver a message of hope by who we are, how we carry ourselves, how we talk, how we walk. And I think that the hope gets instilled into their hearts and souls very quickly. And once we get that, there's just great love for Caron, and they come in with such resistance, but yet better than 93% of our patients go on to long-term care, because it's the old adage, they want what we got.
Right.
And if we can mentor and do all those things with this population, Dr. Joe, we definitely are a treatment center that makes a difference.
Yeah, and I tell you, that's a remarkable number, folks, 93% who, in order to go on to long-term care, you got to recognize there's a need for it. And to be able to break through that resistance and denial is enormous.
Absolutely.
But the part that is remarkable for me is, and I hope that, you know, the audience out there is listening, and if there are parents of kids, the kids are still hungry to be accepted. They're hungry to be taken in and nurtured and respected, even though they come in, as you probably know, you know, they come in with resistance. They come in very often high, needing to be detoxed. Isn't it remarkable how quickly these kids connect?
There is, without a doubt, and I truly feel if you don't have that connect and they stay disconnected, they're pretty resilient. I don't have to tell you, if you have your own treatment center working with adolescents, they can bounce back very quickly. And that's the piece of the denial that continues to protrude in early treatment, that it's just not feeling good today. It's about staying on this mission for the rest of your life and living it in a daily segment. One of the things that they look at is, you know, this is going to be a lifetime of doom. You know, what am I going to do with, you know, a new set of friends? What am I going to do alcohol and drug-free? And we have got to mentor them into early recovery with the hope and being able to understand that this is just a new life, and you live it on a daily basis, one day at a time.
Yeah, and sometimes even, you know, smaller increments of time.
Absolutely.
You know, a minute, an hour. Absolutely. You know, one of the things that we find is because we're learning so much more about adolescent brain development, you know, and I don't want to get sort of shrinky on people, but, you know, these kids really do have a difficult time thinking about the future. And it's as if, you know, there are two main forms of thought happening. You know, the kids are beginning to think about the future, but they're stuck in now, and sometimes all they can see in the future is more here and now. So I think that this is so important for parents to hear, is for a while, and Tom, maybe you can tell me if you agree with this, but for a while, you have to be the future thinker for these kids. You got to be thinking, down the road, this is what can happen, because they're still trying to understand the consequence of the action now. Is that what you find?
Absolutely. I think that we have to basically coach them and live through the experience, strength, and hope voice of other patients who were in their seat, in their unit at some point in time, and that's why we're big advocates of bringing back alumni to basically tell them, this is where I was at. You're exactly right. When they live in that moment early in the treatment experience, their survival skills were get up, use drugs, alcohol, go to bed.
Right.
There was never any short-term goal, much less mid-term or long-term. But once we can get that energy around recovery, that there is hope, I've got to tell you, we have them in law school right now. We have them in medical school. And I really think that is the big reward of being able to do what you and I do. I always say that you can't unplant the seed. Once we get them there, we have to be realists, and not every kid, every young adult is going to be able to sustain recovery. But the ones that do really energizes myself and my staff, in that we can give hope. And even if it's one individual today or tomorrow, that's a victory from my perspective. But we have great numbers that come out and do very well.
Well, I want to hear about that. It's inspirational. We've only been around 5 years, and we're going to be around in a few minutes again. Tom, if you can just stay on the line with us, we'd be really appreciative. This is Common Ground, WATD-FM 95.9. Call us 781-837-4900. We'll be right back.
Gosnold is New England's leader in addiction healthcare and mental health treatment. Gosnold's Reaching Out program is a resource for family members and loved ones affected by addiction. Gosnold gives loved ones access to professionals by offering intervention services, free information forums, family treatment, and support groups. For information or to register for any one of Gosnold's Reaching Out programs, call 774-313-0662. Gosnold on Cape Cod, restoring lives and reuniting families. Online at gosnold.org. Caron Treatment Centers is a leading nonprofit provider of addiction treatment services. Caron offers the most comprehensive treatment services for all stages of life, from teens to older adults. Caron's treatment programs are based on the 12-step philosophy and include an emphasis on the family as a critical aspect of a patient's treatment and recovery. Caron Boston is your key resource for information, referral services, and access to world-class treatment. For more information about Caron's addiction treatment services, call 1-800-216-9512 or visit caron.org.
Do you know of any families who may need support or education about how to deal with a loved one who is going through a difficult time?
Is anyone you know struggling with an alcohol problem?
Do you know of anyone that has an eating disorder or mental illness?
Do you have anyone in your life that is struggling to become functional?
O'Connor Professional Group can help both you and your family through this tough situation.
O'Connor Professional Group offers services like case management, sober companions, consultations, family coaching, and interventions.
O'Connor Professional Group prides itself on offering individually tailored services to address the specific needs of each family.
O'Connor Professional Group offers these services in the Boston, Connecticut, and New York areas.
O'Connor Professional Group helps families navigate some of the toughest decisions they will ever have to make.
For more information, please contact O'Connor Professional Group at 617-910-3940, 617-910-3940.
Or visit them online at o'connorprofessionalgroup.com.
So we are back here at WATD 95.9, and we had the great honor and pleasure of talking with Tom Deitzler from the Caron organization. He is the Senior Clinical Director of Adolescent and Young Adult Services. Welcome back, Tom.
Thank you.
So we've talked a little bit in general. Maybe you could just walk us through for a moment what happens? A kid, how old are your kids? And can you just walk us through them coming in the door and where you go from there?
Sure. We start with age 13, and our adolescent program is tailored for 19-year-olds. However, if that 19-year-old has had some collegiate experience or trade school, we can make a decision at the initial assessment process to move them into our young adult programming. The great thing about our programs, they're gender-specific and age-specific for our adolescents and young adults, which I think clinically is a model that all treatment centers will move forward with in the future. I think it's the only way to be successfender with them. There is some integration for some didactic work, but the clinical work is all done gender specific.
So tell an audience what that really means. What does that gender specific really mean?
Gender specific means that they receive their treatment within the male or female population. And what we do at Caron, we actually have either pods or specific buildings that are identified as male and female. We have a young adult male program building that sits by itself, 24 patients, an adolescent boys unit, primary care, 21 patients, sits by itself, a young men's extended care program, which transitions patients out of the adolescent primary that sits by itself. And then we converted what had been our adolescent building to our adolescent girls, our young women's extended care, and our young adult female. And it has proved very successful for us. Number one, with the delivery of treatment services, keeping the patients motivated, and reducing elopement numbers. We have probably less than 2% elopements from any one of those units, and that's pretty significant for this population and age group. Sure.
I can certainly relate to that. I am curious about your philosophy, though. You're blending some traditional stuff, modern stuff. You got these kids in gender-specific treatments. And do you have any difficulty with 13-year-olds in the same treatment as 17 or 18-year-olds, or are those also sort of specific and separated out?
No, they're in the same unit, Dr. Joe, and what we do is we have developed a positive peer culture, and what we allow the 16, 17, 18, and 19-year-olds do is mentor these younger boys, and they actually become almost like a big brother in a treatment setting. It's pretty phenomenal to witness the evolution of some of the leadership skills of the older boys and girls, and then the movement of some of these younger patients into molding into life and a mindset of abstinence, which we definitely believe in at Caron, that abstinence is the only way to have a quality life in the future, and that thing that we all call recovery.
Sure. I wonder whether you could share a couple of phone numbers for parents or kids who are out there listening. How would they get in touch?
They can call 1-800-678-2332. They're welcome to ask for an admissions staff, and any parent is very welcome to ask for my extension, which is 6194, or they're very welcome to use my direct line, 610-743-6194, and I would glad to have dialogue with them, either the potential patient or the parents and the potential patient, about what we have to offer and what treatment looks like. And I really feel that when that happens with the patient, their anxiety is reduced. They hear the voice of a gentle old man who is pretty sincere about what he does, and I get that alliance almost immediately from that first phone call.
Well, Tom, I feel an alliance with you right now. I mean, just chatting with you. The gentle old man, I don't know about the old man part, but the gentle part, absolutely. So you've been doing this a while. How have you seen addiction treatment change? I mean, I hate to say it to you, Tom, but you've been doing this for almost a quarter of a century. So what do you think? Where has it changed? Where was it? Where is it now? Where do you think it's heading?
Well, I think it's becoming very sophisticated, going into a co-occurring aspect, dealing with the mental health piece and the other addictions that come along with drug and alcohol addiction, gambling, sex.
Internet now?
Yeah, the internet with these kids is amazing. I mean, I tell many folks that some of our more difficult times are taking a iPod, iPad, cell phone, BlackBerry from these kids. It's so much a part of their life, just as the drug, and it's part of their culture, and very difficult with it. I truly believe that, my understanding is that they're already looking at screen addictions for the next DSM development and research. But the sophistication is what is remarkable to me. Instead of browbeating everybody, 12 steps AA, it's a very motivational interviewing type scenario right now where, we meet the patient where they are. Instead of wrestling with them, we dance them through their issues and their resistance. And I think that is going to give longevity to the folks that are new to the field, reduces stress and burnout rates, and even for an old-timer like me, I see much better results keeping the patients in treatment, and it's just the respect factor, talking to them, the old golden rule, talk to them the way you would want to be talked to, respect them the way you would want to be respected.
Yeah, I agree with you completely. It really, I think, does come down to respect. And one of the things that we do at Castle is, the mantra that respect leads to value and value leads to trust. And once these kids begin trusting, it's a whole different chemistry in the brain, but it really gives them a different sense of pleasure. And, what we're finding, which I think is what you're saying, is no one is going to scare a kid out of using drugs or alcohol.
Amen.
If the brain is going to choose between fear and pleasure, it will choose pleasure every time. So what we're trying to do is, what other pleasures can we give these kids from a pro-social way? How can they be constructive, productive? It sounds like you've got something like a mentoring system, a big brother system, which gives these older kids, or sometimes not even the older ones, but kids who say, I want to be a leader. I want to help somebody else. And in that helping, they increase their value. They feel good.
Absolutely.
So the respect thing, I think, is enormous. And how do you then sort of dance? I love the image of the dancing with the parents, because sometimes these parents have felt incredibly disrespected by their kids. How do you bring the parents in?
Well, one of the things we have in both our adolescent and young adults is we have mandatory family programs. The adolescent is a 4-day, the young adult is a 5-day, and they're mandatory. This isn't something that's negotiable.
Wait, what do you mean? The parents are coming to live there too?
They come to the campus for 4 days of treatment with their child. They don't stay on campus.
Yeah.
We have great services around us. In fact, there's a bed and breakfast that touches our campus. 2 or 3 bed and breakfasts, and some of the finer hotels in the area have Caron rates per se. But we bring the parents in for a Saturday of didactic presentations. Sunday, they go to our chapel service with 5 Father Bill and Reverend Jack. And then Sunday afternoon, they integrate into the treatment services with their child. They're actually in treatment with them, looking at timelines of drug use, timelines of behavioral addictions. And it gives the parents, the snapshot of what this has progressed to, and now we would like to put interventions in place and teach them a good way, a healthy way to detach with love, manage their own codependency, sometimes even manage their own addictions.
Wow.
And it's what I feel are the most impactful 4 and 5 days of the treatment experience. Very anxiety-driven for the kids, anxiety and anger for the parents coming in.
Tom,
we teach them that they've got to get healthy with their son and daughter through Al-Anon, through their own family therapy. And we're very successful with that, providing them with continuing care plans and their own treatment-centered focus.
Yeah, I mean, it really takes everyone involved. Tom, I wish I could keep you here for 4 or 5 days as well. We're going to take a brief break, then we'll come back for our last 10 minutes or so. We're at WATD 95.9. Give us a call, 781-837-4900. We'll be right back. Tom, we'll be with you in a moment.
Gosnold is New England's leader in addiction healthcare and mental health treatment. Gosnold's Reaching Out program is a resource for family members and loved ones affected by addiction. Gosnold gives loved ones access to professionals by offering intervention services, free information forums, family treatment, and support groups. For information or to register for any one of Gosnold's Reaching Out programs, call 774-313-0662. Gosnold on Cape Cod, restoring lives and reuniting families. Online at gosnold.org. Over the last 2 years, Eastern Massachusetts has accounted for more emergency room visits related to drugs than any other major metropolitan region in the country. On the South Shore alone, 1 person died every 8 days from a drug overdose. It doesn't have to be this way. Caron Boston is your key for information, referral services, and access to world-class addiction treatment programs offered at Caron Treatment Centers. For more information, call Caron Treatment Centers at 1-800-216-9512 or visit caron.org.
So we are back here at WATD 95.9 on Common Ground. This is Dr. Joe. I'm talking with Tom Deitzler. Tom, we have about 8 or 9 minutes left. I've been asking a lot of questions. I just wonder, is there something in particular that you want to talk about? It's your program. I'm listening.
Sure. I mean, I can tell you that I feel that we're probably the most sophisticated treatment center in America, dealing with adolescents, young adults. All the programs are specifically tailor-made for these gender-specific, age-specific patient populations. We offer a multidisciplinary team approach. We do not cookie-cutter treatment planning, which means Jimmy and Joey get identical treatment plans. They are developed from all of the team members from psychology, medical, nutrition, recreation, spiritual, the clinical staffs of the respective units. And we deliver the true process of multidisciplinary treatment. I feel that the family programs under the leadership of my supervisor, Dave Rotenberg, in the Adolescent is second to none, was very supportive in the strengthening of the young adult, female and male programs. I just feel that we give a child and we give a family system the best opportunity that I know of to get well together, and really be influential in the change process in a very caring and loving manner. We embrace the 12 steps. We believe that this is the answer, but we are also wise enough to know that there are other aspects that need to be managed as well, and we provide those families and those patients with the strands into their next phase of their early recoveries to get them settled in and make those contacts so that their lives can change for the better.
So how long are these kids actually staying with you?
We have it's a 31-day treatment episode in primary care, and then we have 90-day plus extended cares for the adolescents, females and males, and then we also use Caron extended care for the adults. For both males and females on our campus, we use Caron Renaissance, but a host of others, Dr. Joe, that we find are suitable. And I think the key is, and I'm a father and a grandfather who worked to get two daughters in sobriety, working now with a 19-year-old grandson. I understand the financial wrath that this can pose on a family, and we work very diligently to provide scholarshiping and also finding affordable next level of cares, because I do not believe morally or ethically that we need to bankrupt a family, a mom and a dad, grandparents, to make this work. There are a host of so many facilities up and down the Eastern Corridor across the United States that we can make a good fit for their next level of cares.
Yeah, I think that's so important because I don't think any of us are in this for the money. Because if we wanted to do that, we'd be going into different business. This is not about the money, folks. This is about really making a difference and making sure that the lives are not lost. Can you tell me a little bit about the transition? Because there they are, they're with you, 1 month in one place, maybe 3 months in another place. At some point, they got to transition. How do you help with that?
We try to find, if they're collegiate students, we try to find colleges that believe in the sober dorm approach and model. Many we put in continuum of cares, recovery houses, three-quarter houses, where they are in a structured environment to continue the accountability piece. I mean, as well as I, if you take these young folks and put them back into their home environments or the environment they came to us from, it's clinical suicide. Yeah. And we try to distance them from that as long as we possibly can so that they can get a very nourishing, strong, supportive recovery network. And the longer that they're away from that, it also gives the parental system the time to heal and get their treatment needs and define, the tough love approach that, and the approach that, from here on we're going to support your recovery. We are no longer going to invest in your addiction.
Right.
And those are tough decisions for moms and dads and grandparents.
They are tough, and the part that's so striking is recognizing, and the kids need to recognize, when they're doing drugs, they're not just affecting their brain, they're affecting the brain of all the people around them. That's Absolutely. Important stuff. One more time, can you give us the phone number of where people can reach you, Tom? And then we're going to, unfortunately, have to go.
Sure. 1-800-678-2332. Ask for an admission specialist or ask for my extension 6194 or my direct line 610-743-6194. Provide me a return number and I'll get back to a mom and dad or a potential referral or patient as soon as possible.
Folks, there's a lot of help out there. Please call. You don't have to do this on your own. This is Dr. Joe. I am thanking Tom Deitzler, the Senior Clinical Director of Adolescent and Young Adult Services, a very kind man who's been doing this for a long time and helped a lot of kids. Folks, this is Dr. Joe. We are going to be closing down here at Common Ground, WATD FM 95.9. Please stay tuned. We got a lot of great music coming up. Thank goodness that UMass won, and let's hope that you're a winner too. Next week, we'll see you and hear you right back here. Common Ground, Dr. Joe, thanks for being here.